Hi, I'm Instructor Fratt with Victor Valley College's EMT program. Today we're going to be going over emergency childbirth. We're going to start with complications of pregnancy. This includes ectopic pregnancy, abruptio placenta, placenta previa, spontaneous abortion, and toxemia of pregnancy, which is preeclampsia and eclampsia. We're also going to state our complications of delivery, which is prolapse cord, breech presentation, limb presentation, nuchal cord, meconium staining, shoulder dystocia, and hemorrhage. You're then going to ask the expectant mother the pertinent questions. You could use pea pebbles. Para, how many children do you have? Gravida, how many times have you been pregnant? Have you had any prenatal care? Are you expecting any complications with this pregnancy? Has your bag of waters broke? Do you have an urge to bear down or have bowel movement? What are your length of contractions and how far apart are they? What is your expected due date and your last menstrual period? And S, may I look to see if your baby's head is visible? Now you're going to start your skill. BSI penman, I'm going to don my appropriate PPE and ready my OB kit. I'm then going to prepare the mother for delivery, having her lay down on her back, her knees drawn up and spread apart. I'm then going to cover the mother's legs with sheets and place sheets underneath the mother's buttocks. We're then going to prepare the mother for delivery and explain the procedure to mom. We're going to visualize the genitalia. When the head has become visible or crowding, birth is imminent. We're going to clean the genitalia with sterile wipes from front to back. We're going to then, after we clean, don our sterile gloves. It is best practice to doff your dirty gloves over a second pair of clean, non-sterile gloves. You will then don your sterile gloves. You're going to place pressure on the baby's head to prevent explosive birth, applying gentle pressure. You're going to instruct the mother with her next contraction. Now she'll take a deep breath and hold, pushing for 10 seconds, and then exhale. We're going to place pressure on the perineum to prevent tearing. And if the head is delivered, you notice the amniotic sac is still intact, you're going to gently pinch the amniotic sac and in a snapping motion, rupture the amniotic sac, taking note of the fluid color. After the infant's head is delivered, if you notice a nuchal cord, gently take 2 fingers and remove the nuchal cord from around the infant's head. If not successful, you're going to clamp 3 inches apart and cut in the middle. Careful to cut away from the baby. Once the baby's head is delivered, be sure to suction the baby's mouth and then nose. Making sure that you get all mucus out. You're going to continue supporting the baby's head and instruct the mother to push on the next contraction. Be aware that the baby will be slippery and to hold carefully. Top shoulder will deliver first and then bottom shoulder. Baby will fully deliver and you will note the time of delivery. Stimulate the baby with towels as you dry off the patient. And then you're going to assess the 1-minute APGAR, noting the appearance of the baby if they're pink all over, the pulse if it's over 100 beats per minute, the grimace if the baby's sneezing, coughing, and crying, the activity if they're having active movement, and the respiratory effort if they have a good, strong cry. We're then going to clamp and cut the cord. We're going to clamp 7 inches away from the baby and 3 inches away from the first clamp. Once the umbilical cord has stopped pulsating, we're going to cut the middle. Ensure that the umbilical cord is not bleeding from either end. We're then going to wrap the baby in a towel or blanket to prevent heat loss. If the baby is doing well, you can encourage the mother to breastfeed and hold the baby. After 5 minutes post-delivery, we're going to reassess APGAR and compare it to the 1-minute APGAR. We're then going to ask the mother if she has the urge to push again. At this point, we will deliver the placenta. We're going to assess the placenta, making sure that it is intact, that there's nothing missing. And we're going to place the placenta in a bio bag and note the time of placenta delivery. This placenta will be delivered with the mother to the hospital. We're then going to place a sterile pad onto the mother's vagina, have her lower her legs, and keep her legs drawn together. We'll observe for any profuse bleeding. If the mother is hemorrhaging, we have to massage the fundus. We'll then transport the mother and baby to the hospital, continuing to assess both while en route.